The 5 questions USMLE will ask about SLE on step 1, step 2, and step 3. And as usual, I'll leave the hardest one for the end. Question number 1, they'll give you a young woman with malar rash, joint pain, and fatigue, and they'll ask about what's the best initial test. Now, some students jump to anti-dsDNA or anti-Smith antibody, but the answer is ANA, which is anti-nuclear antibody. It is over 95% sensitive. A negative ANA essentially rules out lupus. So ANA screens, then you confirm with specific antibodies. This brings me to question number 2. They'll ask you about which antibody is most specific for lupus. Now I'll ask you, what's the difference between anti-dsDNA and anti-Smith? Both are specific for lupus. So anti-Smith is actually the most specific, which means if it's positive, they have lupus, period. But anti-dsDNA correlates with disease activity, especially lupus nephritis. So remember, Smith for diagnosis, dsDNA for monitoring lupus flares. Question number 3, they'll give you a SLE patient with proteinuria, hematuria, and rising creatinine, and they'll ask about the renal pathology that they have. The answer here is lupus nephritis, and USMLE wants you to know class 4 diffuse proliferative glomerulonephritis seen in SLE is the most common and the most severe. Renal biopsy here will show wire loop appearance from subendothelial immune deposits. Treatment is steroids plus mycophenolate or cyclophosphamide. Question 4, they'll give you a lupus patient with recurrent miscarriages or blood clots, and they'll ask you what antibodies to check. The answer is anti-phospholipid antibodies, mainly lupus anticoagulant, anti-cardiolipin, and anti-beta-2 glycoprotein. This is commonly seen in pregnancy, and the treatment here is heparin plus aspirin. Question 5, they will give you a patient who was started on some drugs, and after a few months, they develop lupus symptoms with positive ANA, and they'll ask you about what's happening. Some students here will say, okay, this is SLE, but the answer is not SLE, it is drug-induced lupus, and the key antibody here is antihistone, not anti-dsDNA or anti-Smith. And the classic drugs that cause drug-induced lupus are hydralazine, procainamide, isoniazid, and minocycline. And the best part about it, you stop the drug and it reverses.